back, etc. Oh, sorry, gave me a little signal recording.
Sorry.
No, it's okay. Do you want me to pause? Okay.
Sorry, I forgot to hit record.
Oh, okay. So we have these larger bundles of lymph nodes at those spots that I just mentioned, armpits, groin, neck. And then we have little vessels throughout our body that connect the larger bundles, and it moves fluid throughout the body. And the type of fluid that it moves is waste material. So as a part of our immune system, that we have all of this healthy oxygen and nutrients that go out to the body, they go through their processes, and then there's waste material to be carried back into the system. And the lymphatic system is responsible for that. And each area of the body has a special pathway that it goes. So the arm, it's going to follow a certain pathway, but there's different pathways that it can go also. So if we think about as like traffic this morning, I don't know if anybody else is from the Middletown area, Route 1, Route 13 was closed down, so all of us had to take back ways. And so I was a little worried about getting here. So even though it's normal to take that normal route, the main route that usually makes sense, if there's something wrong with that route, if it's blocked or you can't get through, you can take back roads. And the same thing with our lymphatic system. When we can't go the route that we're used to, it can be redirected. Okay, Erica, if you want to switch it to the next slide, that's okay. So what is lymphedema? Lymphedema is an accumulation of fluid in your tissues, and it most commonly occurs in the arms or the legs. It can also happen in the breast, your neck, face. So it can really occur anywhere in the body. But this fluid is thicker. The lymphatic fluid is thicker fluid. That route can be blocked by either the lymph nodes that are there not working as well because they've been radiated, or because lymph nodes have been taken out. So, and sometimes it's both. You have lymph nodes that are taken out, and then the ones that are left over are, they have radiation therapy. So then you have even more of a traffic jam. So what are the symptoms of lymphedema? The first symptom you will most likely feel before a doctor can see it or you can see it. So it's really important to listen to your body. And if you have a feeling of heaviness or fullness or thickness, that is the first sign of lymphedema. And then other ways that you can, then it's more visual. For example, you will see swelling, or swelling will be able to be measured. Maybe your range of motion isn't the same. Jewelry won't fit as well. Some people will notice they always wear a certain ring, and now that ring isn't, or their watch, they have to wear a little bigger. Or changes in the skin. So and that's also good to just be aware of, what does my skin usually feel like? And does it feel the same right versus left? Because since that lymphatic fluid is a little bit thicker, your skin will feel thicker, headed towards a consistency of sometimes Play-Doh type of consistency. Now that's when it's gotten worse, but if you're noticing headed in that direction, that's something that you would notice too. And yep, perfect. How likely am I to get lymphedema? I think it's really important to acknowledge that everybody's different. So it's not that I had lymph nodes taken out and you're hearing all this information and thinking that there's a really good chance of getting lymphedema. It's really important to note, well, how many lymph nodes did you have taken out? Was it 1 or 2? Was it 15? Was it 30? What areas were radiated? So you may have a couple of different areas radiated. It may have just been one. So just because we're saying that having lymph nodes removed or going through radiation therapy puts you at risk, take a moment to think about that's a blanket statement, and to know that there's different levels to all of this. And talking with your medical team can certainly help you identify, okay, so I hear this, I'm worried about this. Can you talk to me about my treatment and what is my risk? And then you know how vigilant to be in order to monitor yourself. How can I self-assess and know when to get help? Well, listening to your body, because like I said, that first symptom is going to be something that you feel, not something that the doctor or you can visually see. And sometimes not, and sometimes you don't feel it, but most of the time it's something. I thought that was going to happen earlier. Sorry, ladies. Okay, I think I got it in better than I have. Does your skin look or feel different, like we just talked about? And then if you have breast lymphedema or arm lymphedema, and that's what you're worried, one of the things that you can do for a self-assessment for your arms, and you can do it with me, is to make a fist and to look at your knuckles and look right to left and see, do they look symmetrical? And then if you're in front of a mirror, you could hold up your elbows and you're looking in the mirror and you can see, does that look symmetrical? And then bringing your arms out in the mirror and looking, does this look symmetrical? Also, sometimes if you're right hand dominant, your right arm may have a little bit of, even if we're not, in the gym working out, etc., just life in general. Sometimes our dominant arm may just be a hair more toned because we're always using it. So if you see a little bit, but nothing, you're not feeling anything, everything else looks symmetrical, keep that in mind too. But in general, it's that feeling and then looking at bony areas and going like this can help you see if you're seeing any differences. How is lymphedema treated? So this is all inclusive, everything together. It's called complete decongestive therapy, sometimes abbreviated CDT. That encompasses everything that a lymphedema therapist would do. I think it's also important to note that it's a very specialized treatment. So you want to make sure that when you do get therapy for lymphedema, that it's from someone who has CLT at the end of their name, a certified lymphedema therapist. And I do have providers at the end of the presentation in our local area that you could go to. So things that they would do, and for someone who has already been through therapy, you might see something up here that you didn't have. Well, maybe it really wasn't indicated. We don't throw everything at everybody. We really see what do you need at the time. So if you're seeing something that wasn't done for you, not to be upset, it probably just wasn't indicated for you at that moment. So when you're seeing a therapist, there's lots of talking, education on, what do you do in your life? What things should you be careful with? Answering any questions, giving you precautions. Scar management, fluid doesn't flow well over scars. So if there is a scar somewhere, scar management, teaching you how to do scar management, us working on the scar. Sometimes we can use kinesio tape or different products on it. Again, being mindful, all of this is if someone didn't do that for you, maybe there was a reason. So if there's a scar in an area where it was also radiated, I'm not going to be putting tape. I'm not going to be putting any other products for the most part. So again, this can change for individual needs. But in general, if there's a scar in the area, we want to make sure that's mobile as possible so it doesn't create a road, a speed bump for that fluid to get over. Lymphatic drainage massage. So we do a lot of that. That's what I love to do. That's what most patients love. I'm getting over here. So important. And as a therapist, that's what I do. And then we're also teaching you how to do lymphatic drainage too, because that's wonderful if we can do it, but you need that every day and to keep things moving. So we'll go over how to do that a little bit here too. Um, uh, so training how to do lymphatic drainage on yourself. The next two are bandaging and garments. And so that is important to note that there's two phases of therapy for lymphedema. The bandaging is to push fluid out. And once that fluid is out, then we can order garments. So not everybody always needs bandaging. Many do. But again, that bandaging is to push that fluid out. And then once we get your arm down to size, your leg down to size, then we say, okay, this is, if we're going to get a garment, an arm sleeve or a sock, a knee high, now it's at the size that we want to put that sock on, because the garment, the intention is to prevent fluid from coming back in. A garment's intention is not to push the fluid out. Sometimes it's an added bonus and it can a little bit, but really the bandages push it out and the garment is to keep it that good size. There are many different types of garments. So if you've gone to therapy in the past, know that your body can change. There's so many different fabrics, different levels of tightness. There's gauntlets with no fingers. There's gloves with some, fingers extending here. That the garment that was the most appropriate for you a few years ago might not be the same garment that's appropriate for you now. So that's something that you may want to revisit, if some time has passed. Kinesiotaping. So sometimes, I don't know if anybody's familiar with kinesiotaping, getting some head nods. Sometimes if anybody isn't, you'll see it sometimes on athletes. They'll, tape their calves or their shoulders to enhance performance, but it's also used to bring fluid out of the body. Some people feel they love it, they really see a difference, and some people say, I don't really see much of a difference. So it's something that if it's appropriate for you, that we can try. And if it helps, great. And if it doesn't, we move on to the next thing. But the idea with that is that if you have that tape on your skin every time you're moving, it's stretching the skin ever so slightly. And it's right along the pathway that we want fluid to flow. The reason that skin stretch is so important is that, so let's say this is your skin, and then all of those lymphatic little vessels underneath are attached to the skin like this. They open when the skin is stretched. So if you stretch the skin, that little vessel opens up and dumps to the next vessel. So it's a stretch, we dump the fluid, and we go to the next, and we stretch the fluid. So if you have something that's stretching the skin ever so slightly when you move all day, it's really keeping that channel open and fluid moving. And you'll notice that when you are getting a lymphatic massage, that we're doing a lot of skin stretching and not that deep tissue work. Sometimes we go deeper, but it's a lot of skin stretching, and it's all because that's what's opening up those channels and dumping it to the next point. Exercise for increased lymphatic flow. Exercise is very important. So our muscles, so a massage therapist can move the outside of the skin, but muscles underneath that, all those lymphatic vessels are pushing on that fluid internally. So it's helping to pump too. So exercise is important. If you have been told to wear a garment or that you should have compression on, then you should absolutely be wearing your garment when exercising, because we don't want fluid just coming. We want that compression on top, the muscle pump from underneath, and then it has nowhere to go except for out. So wearing a compression garment with your exercise is a great way to push fluid. It doesn't have to be anything too strenuous, it's just movement. A compression pump. This is another thing that has changed over the years a little bit. The main change that I'm seeing is that there is a machine called a Flexi Touch. It's not covered by all insurances. Do you have one? You do. Do you like it? Yeah. So it's a little different in the sense that the compression pumps used to be just the arm or just the leg, and it would have a few chambers and it would pump, pump, pump. But the Flexi Touch has many chambers. It's very soft. It works your core because with a lymphatic massage, we're going to clear your core first and then have it work on the extremities, and it mimics that. So it's a bit nicer of a machine. It is more expensive, but insurance companies are starting to really get on board with that, and we're seeing a lot more insurance companies cover it. So it might be something to look into. Again, not everybody needs one. So if you've been through therapy before and your therapist hasn't recommended one, it's very well made that you didn't need that. So again, this is complete decongestive therapy encompasses all of this. And when you go to therapy, they pick what would be the most appropriate for you. Here are just some pictures that would help jog my mind of some different things to note to tell you. Garment care, we'll go to that one where the guy is putting on his sock, or lady is putting on her sock at the bottom left. I just wanted to remind you, for putting on your garments, it shouldn't be one of those things that you're holding the top of the garment and you just slip it on like a regular sock and you're pulling at the band, whether it's your arm at the top or that your garments will wear out pretty quick. I know that these are hard to get on, but sometimes if you flip half of it inside out and then just slide the foot piece on, and then you gather up a little bit more, and then you take it up to your mid calf, and then you take it up, that it's going to be easier for most. And it's going to take care of your garment. You can see in the picture next, right in the middle, that they're using special gloves. So gardening or dish gloves can sometimes be used. There's a great green pair. If you on Amazon, donning gloves, and they're great for putting garments on. So these gloves, what they can do is pretty much they take it, you can twist it, you can pull it up, and just that contact with those gloves on there, you have a lot of control to maneuver the garment on a lot better, saving you some hassle and having your garments last longer. Garments should be replaced every 6 months if they're worn regularly. Getting a lot of laughs. So another thing, so we think about like, oh my gosh, I feel like my edema might be getting worse. And so to stop and think, well, how long have I had these garments? How long has it been since I've had a consult to see if these garments are still the appropriate fabric and brand for me? So that could definitely factor. You could go a little over the 6 months. Some people certainly do, but it should not be going into like a year plus. They're really not going to be working nicely for you. They don't have to look as medical. There's a lot of fun prints. So in the top right, that's an example of, you can get some medical grade compression. Not appropriate for everybody, but the companies are doing a wonderful job now with trying to make, even if it's like more of the medical one that you're seeing in the bottom left, some of them are making them in, like a fuchsia or whatever, different types of colors. But sometimes you do have some more options there. I have that picture of Velcro, so I didn't forget to tell you that there's also Velcro garments. So if putting garments on and off is really tough, or putting on and off bandages is really tough, that you can get some garments that slip on and that you put on with the pieces of Velcro give you the compression. So just another option. Oh, the measuring tape. I didn't do that. Sorry, Erica. So this is just a reminder. It's a good way to monitor if you had some baseline measurements. Okay, I'm feeling really good about my arm right now. I'm feeling really good about my leg. Let me take some measurements. So I have this tucked away, and if I feel like, oh, I wonder if this is getting bigger, whether it's it doesn't have to be at anywhere specific. You could be like at that freckle on my forearm, or and then you in your little log, freckle at forearm, or 2 inches above your elbow, or freckle on the top of your arm. But just something for you to measure. Also, if you were to order garments on your own, really making sure that you're in the right size of that garment. There are many different companies. So when I'm ordering a garment for somebody and somebody's foot measures up, their ankle fits in that size grid, and their calf, it's like, you know, an inch or so outside of that size, I'm going to look at a different company, and then look at their size chart. Foot, ankle, calf is still not fitting into one size. I'm going to go to another company, and then make sure that when I order that sock or that arm garment, that it fits into all areas measured, that we're not just kind of like, it'll be close enough. Because that close enough, if it's too far off, then it's not going to be working well for you. If measurements are really not fitting into any size grid, then that's when we would want to do a custom garment, and you would see a lymphedema therapist to measure and order a garment created just for you. And let's see, there was something else I was going to note about the garments and fitting. Just custom. Hopefully it'll come back to me. Okay. This is a picture of a lovely patient that I see and who is willing to share her photos with us. So this is an example of the kinesio taping that I do and bandaging. So, and it's always different, so we didn't really use kinesio tape often, but sometimes there's just certain days where, we needed a little extra help. So we would add it. And her fingers aren't bandaged. Sometimes I'm bandaging fingers, sometimes I'm not, but it's an example of what you would see for kinesio taping or bandaging. Precautions. So what can you do to prevent lymphedema from getting worse? Or if you're at risk for lymphedema, what can you do to prevent it from actually happening? These are general guidelines. Again, so thinking about, there's some people that have had 1 or 2 lymph nodes removed, or again, 15 plus. And so these are guidelines that are given to everybody. So just kind of keep that in mind as you're thinking about your own personal precautions that you should take. The reason, so there's wear insect repellent, stay moisturized, wear sunscreen, wear gloves when gardening. This is all because the lymphatic system is part of your immune system. Let's say in a healthy arm that hasn't been affected with anything, that you get a mosquito bite. Mosquitoes are notorious for bringing bacteria, right? But our body has a way of getting that bacteria, clears it from your body. It's just naturally a part of what we do. But if that arm has a more sluggish response time to get fluid out of the arm, then that bacteria can sit, or a cut outside, skin getting too dry or open to the environment, that whenever there's a risk for infection, that body can't clear that arm and protect it the way that it used to. So you may feel, I'm fine, I've been gardening for years, I don't need those gloves. Well, still put them on, because a scratch that would be fine on your other arm or years ago might not affect that arm as well. So that's why all of those precautions are there. Now, the last one I have a little star on because there's caused some debate in the area, but all for the other arm for injections and blood pressures. So there is no research that shows that having an injection, a needle prick, or blood pressure taken from your involved arm will cause lymphedema. And so some of the medical providers in our area were getting a little upset with us by telling people this because they're going into their doctor's office, no, you can't use that arm. And there was almost a fear with it. So then they wanted us to take the guideline away altogether. So I think that this one should be taken as just background knowledge. I personally and other therapists have seen patients come in and that they had an exacerbation after, having, an injection or, whatever the case is. So from our personal, and I checked with the other therapists in the area too. They're like, so what are you doing with this precaution? And they're like, we're educating. We're also putting that there's no medical research out there. A research study has not been shown. But if it were me, I would. And if I had one arm that was at risk and another arm that was not at risk, I would offer them this arm. I would go to the other arm. However, if it was medically necessary and I'm in an emergency room and medical treatment is needed, it's okay. Give them that arm. Okay, that we shouldn't be declining the medical team to use that arm if it is medically necessary. I have had somebody call me from the ICU that they didn't want that arm to be used for their mother, and I said, we need to get off the phone, go tell them to use whatever arm they need at this point. So again, thinking about these are just things to think about. If it's optional, great. If it's not, we let it go. We'll go into the next slide, Erica. When and who needs therapy? I think at any point checking in with a therapist is good to get this type of information, whether to have questions answered, to get some baseline measurements, to learn what you can do. And you're not going to, a lot of times people think of physical therapy, okay, I'm gonna have to go twice a week for weeks and weeks, and that's not necessarily the case. And depending on where you are, depends on how much therapy you need. So you may only need 1 or 2 visits to get some baseline measurements, some education on where you're currently at. But if you have an exacerbation, you might need to go 2 times a week until it calms down. And this is just a reminder, if your therapy has been in the past, just remember your body can change. Garments should be replaced every 6 months. If you feel your garment is managing your lymphedema well, and this is the first reorder, maybe even the second reorder that you need, and you're like, fits great, doing fine, you usually will know your vendor of what company it was ordered from, and you can just contact the vendor and say, can you send me the exact same garment that I already have? If you're wondering, like, yeah, some days I'm getting flare-ups, your gut just tells you that maybe you need something different, get back into, or if it's been a few years, I'm going to get back into a physical therapist or an occupational therapist. That's a CLT, and have them reassess and see whether you should reorder that same garment or whether we should switch up fabrics, switch up brands, levels of compression, to see if that's still okay. Let's see how we're doing on time. Okay, yeah. So we're going to talk about doing some drainage today. And what's that?
Breathing.
Breathing, yeah. Are you surprised by that? Or, okay. Well, I'm glad. So this is great. You guys come out with your thoughts. So the reason that diaphragmatic breathing is important is because you have lymph nodes around your diaphragm. So doing some deep diaphragmatic breathing is a gentle way for you to pump the system internally. It's not that you're going to do some breath work and your arm is going to magically look better. But again, we want to just gently get that lymphatic system pumping in so many different ways that we will start with diaphragmatic breathing and end with diaphragmatic breathing. The reason that we start with it is because if we were to push fluid to the core, or if we were to push fluid up here, but none of this has been emptied out yet, it doesn't really have a place to go. So we are always working on the problematic area last. We're clearing out, and same thing with that traffic jam that I was talking about. You want to clear the roads in front of you and then take the guy in the back and then let him go.
Read for us right now.
Sure. So, and that's what I was going to have you guys practice too. And that, so thinking about your rib cage, try to, when you breathe in, have your rib cage expand out, almost like an accordion, pressing out into your hands. So your rib cage should widen into your hands. And also let some go into your belly. A lot of times in the past, we've been calling it belly breathing, but I think it's really important to also think about your rib cage, because your diaphragm, if we picture our diaphragm as this dome muscle, and it attaches into the rib cage at all points in a dome-like structure. So when we are expanding out into our rib cage, we're pulling on that diaphragm, a 360-degree movement. The most important part of that breath, excuse me, is the exhale. So when you exhale, really let the belly sink in, the rib cage come in, because that's when you're getting that internal push on those lymph nodes. So just spending some time doing some breath work, and this can be done sitting, lying down, reclined in a chair, doesn't really matter, because you can breathe anywhere. Okay, and it doesn't have to be timed with everything else that you're doing. So I don't know if everyone here has the same problematic area or not. Do you happen to know off the top of your head, Eric? I don't.
So I know where it's leg, right leg.
Okay. So we'll do both. Yeah. Is there anybody out there with neck edema? If anybody can chime in on Zoom, or you can let me know. I did hear a little ding, but so wherever we are taking the fluid, we have trunk. Okay, yeah. So trunk, you're going to want to work on what I'm saying for both arm and leg. Okay. So what I'm going to go back. Could you go back to the very first slide with the picture of the lymphatic system? So whenever we're doing lymphatic drainage, as a therapist, I'm thinking, where is my dumping point? Where am I going to want to dump this fluid? And so let's take the armpit as an example. So most of that fluid, if you can visualize coming up those little vessels into the armpit. Now, if that armpit, you've had a couple of lymph nodes taken away and then you had radiation there, I no longer want that to be my stopping point, my dumping point for that. Same thing in the leg. If there's been some lymph nodes taken away in the pelvis or in the groin and then radiated, usually that's a healthy spot for that leg to dump the fluid, but we don't want it to be the stopping point anymore. We need to open up pathways beyond that to keep the fluid going. So I want to figure out my dumping point. So if it is my right arm, I have a couple of options. It could be the opposite armpit. It could be the same hip. Let's say arm. We're going to do the arm first, and let's pretend it's our right arm. And so that left armpit is going to be our dumping point. We want to clear out the dumping point first. And that's why when I said, let's do some drainage, the second step is identify the dumping spot. This dumping spot is no longer working very well, so I'm going to take it past that and dump it in the other side. Okay, so the first thing is to clear out my dumping spot. How do I do that? You can use a flat hand and do some circles in the armpit, about 15 times. We used to always do this. Now we've also added a technique, because there was a a research study that showed by doing this, they measured the fluid in the lymph nodes before and after, and that those lymph nodes were cleared out 80 to 90% after doing this technique. So some of us have switched to doing a towel pump in the arm instead, but you would get a hand towel and roll it up, place it in the armpit, and press into it. Doesn't have to be a really hard press. Your arm doesn't have to come up high, but you're going to press 10 times, and that's going to, now you have cleared out your dumping spot. And then there's kind of, now, if you're working with a therapist, we would break it down into more steps because there's a lot more to this, but this is just some general thoughts, okay? So then you're just kind of sweeping up that arm and across. Sweeping is one way to get it. Skin stretching, because we talked about the importance of skin stretching. If you have the time, gather it up and stretch. And then, because it's just this stretch to the skin. Yep, just like that. I'm not going over the skin. I'm stretching my skin. Go to the next spot, stretch the skin and pause. And then I'm going to do that the whole way up until I get to my dumping point. Nice and slow. Again, if you're working with a therapist, we will be adding in a few steps. For the leg, same thing. So if my involved leg, we'll pick a right leg. So if my involved leg is my right leg, we want to find our dumping spot. This area is getting overloaded, so we need to find a new spot. Let's just keep it going up. Let's try to take it up as you've got another bundle of lymph nodes here. So the dumping spot for the right leg, you would do the right armpit. You're going to clear your dumping spot. We can chat afterwards if you need a little pathway for you. So you're going to clear your dumping spot in the same thing. You can do sweeps, but you can also do skin stretching and walk it up to your dumping spot. Again, many other points along the way if you're working with a therapist. This is like a speed course. And this isn't the only way. So for that arm, I may also be taking it other pathways. I'm just going to teach one pathway at this point. So again, you identify where do I want to dump my fluid. If it's the arm, you can think about the opposite armpit. If it's the leg, keep it going up to that same armpit. If it's trunk, you're going to utilize all 4 quadrants. So if it's your pelvis that had the lymph nodes taken out, you're going to want to take maybe or up and over, kind of some skin stretching and sweeping. And these are your dumping spots. So you identify your dumping spot and then you sweep or skin stretch to the dumping spot.
Can we do both of those, or is that one of those?
You can do both of them. The skin stretch confuses some people. So then I would say do the sweep. The sweep is not as effective, but it's still something. So that's where I teach both. Mm-hmm. Good question, which leads me to my next slide. Thank you, Erin. Okay. Yes. Okay, so what position should I be in and how often should I do this? So we'll go to the second question first, since Erin just asked. And so if you are doing this for keeping a healthy lymphatic system as prevention, you could do this a couple of times a week. But if you're having a flare up in your symptoms and you are trying to move fluid out of the system, then I would do it twice a day. So it really depends on what stage you're at. And that won't always be the same. And just a heads up, summertime can be a little more challenging managing edema because of the heat and it brings fluid. And so not to be too discouraged that, winter does come eventually too. And sometimes things can, waver a bit. What position should I be in? So we think we're moving fluid. And even though it's inside of our body, it's still gravity can have an impact. So if you're working on getting fluid out of your foot, instead of having it propped down, if you could instead have it propped up on the couch, maybe doing this in a recliner, but thinking about the effects of gravity. Arm, it doesn't matter as much, maybe if you have it propped up beside you, but especially for the leg, I would try to have it up when you're doing this, anything that can help. And then we'll go on to the next one. Local providers. So of course I put myself on there. And then a few others. There's Daphne at NovaCare. She's located in Wilmington on Pennsylvania Avenue. And the Helen Graham Cancer Center. There's a fax number. If you go to the cancer center, please and your doctor is not from within the cancer center. It's very important that on the script that they fax over, they put cancer or, needs cancer rehab, something. Those faxes are going to a general scheduling center. And so if they say and they don't have the medical knowledge to determine, they don't see lymphedema and think they need to get into the cancer center. So it's really important that your provider needs cancer rehab in addition to lymphedema. So when that scheduler gets it, that they're not scheduling you in some satellite location with some ankle sprains and shoulder problems. First State Rehab at Home, they primarily work with lower extremity lymphedema. They do some arms. They provide services all at home. They go Pennsylvania. I think they're tri-state area, at least in Pennsylvania, I think too. They are other states other than Delaware, yeah. All of them listed there, except for myself. They accept insurance. I'm an out-of-network provider. One of the reasons that I have done that, and some differences, for example, I've worked with a lot of people, so they're done their therapy at the cancer center, and then they come to see me. A lot of it, so when it's insurance-based, it's okay, do you have the tools needed? They're gonna, in a lovely way, there's nothing negative about this, but just the difference is or do you have the tools that you need to manage this on your own? And so, for example, the lymphatic massage, do you know how to do it yourself? Okay, you're good to go. So I personally think that a good lymphatic drainage massage every once in a while for people going through this is a lifetime condition, and I feel strongly about checking in with somebody every once in a while. In the insurance-based world, it was, why would you want to see somebody on every month, or like once a time a month or once quarterly or something like that? This gives me the more freedom. Call me if you need me. You might not need me for 3 or 4 months. You might need me once a week this week. I mean, this month. It gives us that flexibility to go with whatever your body is going through. I can take you through the bandaging, ordering you a compression pump, ordering you garments. I can take you through all of that, and then the maintenance on the other end, or I can just meet with you afterwards, after you've been through all of that, and then just kind of, a lot of people, what I hear is, I'm doing okay. I still can't get it the way that when I would have a lymphatic drainage massage, I still can't get it to that point. And I feel like if I had a session every month or, whatever, everybody's body's different, that I would be able to manage this on my own a lot better. So that's a little bit of the difference between going out of network and staying in network with your insurance. And I can help guide you with any questions there too. As an out-of-network provider, I do provide all of the paperwork that you can submit to your insurance if you have out-of-network physical therapy benefits, and everyone except for Medicare, unfortunately. Other insurance companies, they have that option. Trying to think if there's anything else. Any questions? This would be good time for questions.
Something, I mean, right here, yeah, Planet Square and also Westchester.
A provider. The closest provider I would know is Daphne on Pennsylvania Avenue. I can reach out to Lisa and Aaron too, because I know that they're in that area, and that's one of the challenges. I don't know if there's a provider up there.
I had asked before, actually for people, and there is not a lot,
Yeah, there's,
unfortunately.
we don't know of anybody. It's a very specialized group. Yeah.
So you could just let people know if they're online and when they can ask a question, you'll be able to.
And everyone's unmuted that's on Zoom. So if anybody has a question, feel free to.
Okay. Someone in the chat is courting part of the
Great question. So sometimes if you have a flare up of your cording, it can cause some swelling. And as we work through the cording, a lot of times we'll see that edema go down. So this isn't a case where you've been good to go, that there's lymphedema isn't something that you're actively managing, but many times we'll see cording and some swelling happen at the same time, and are really like, oh no, what's this? But as we release that cording, then the swelling also goes down. Yep, so sometimes they can overlap a bit. Now they're muted, it looks like. Oh, maybe you guys muted yourselves. Okay, that's okay. Anybody?
Does numbness go along with that too? So if you're having some numbness in your hand or your underarm, is that part of the swelling?
Maybe it's not as common, but sometimes if there's swelling around, means we've got lots of nerves. So that's one I would delve into a little bit closer. The question was, if you're having numbness and tingling down the arm, is that part of edema or not? Sometimes it's not that common. I would be looking, I'd be doing a screen with your neck and your shoulder. The body's all connected. So maybe as this becomes heavier, there's more pressure on the nerves here, or with swelling, maybe there is pressure on nerves there. That's not a cut and dry yes or no, but maybe indirectly it could. Any other questions?
Well, Janelle, I don't have a question, but I want to thank you. This has been very, very informative. And
oh, great.
I'm zooming from Kansas City, Missouri.
Oh, wow.
I'm a supporter of the cancer support community of Delaware via my sister, who
okay.
Her company and she are big supporters of CSCD. So thank you very, very much.
Oh, well, thank you for that feedback. I appreciate it. Okay.
Okay, so I'm going to stop the recording.
Okay. Well, thank you very much